It is the leading cause of accidental death for seniors 75 years of age and older, and it is almost completely preventable. We are talking about falls, but there are many things you can do to reduce your or someone you love's risk. And Drew Ratcliffe of Nurse Next Door Healthcare Services joins us now with some tips. Thank you so much for coming in. This is a very important topic.
It is. Thanks for having me. This is the early eve of our Fall Prevention Week,
yes,
which starts tomorrow. And really, we created the program 5 years ago for the simple goal of helping seniors avoid a catastrophic fall at home.
Now, there are really some very alarming statistics associated with falling. The injury rate is very high.
Sure. So we know that 1 in 3 seniors living at home will suffer a fall every year. And we also know that 85% of injury-related hospital admissions are all because of a fall. So when you put those numbers together with our commitment to helping seniors remain safely at home, again, that the program for us means that if we can make a difference and keep people at home a bit longer, then we're doing something right.
And so what you do is you offer free assessments right now where you will go to someone's home and assess what the potential dangers are and suggest some changes?
Yeah, so all week we're open 24 hours a day. Monday to Friday, we're encouraging seniors and their families to call us and book a free safety assessment. And really what that looks like is we go through with a trained professional creating a risk assessment profile. But again, without going through all that now, we're looking at some really common causes of a fall. Ones that by and large are all preventable.
Well, let's talk about this. This is very important information.
Sure.
So just from my own observation, I have an elderly aunt, and they have a lot of little throw rugs in the house that
scatter rugs.
Oh, constantly tripping on them, and it makes me very concerned. So is that one of the causes?
It's a huge one, and for whatever reason, your aunt's not alone. She's one of the many seniors who a scatter rug is beloved, and it has sentimental attachment.
She loves them, and she does have sentimental attachment. Exactly.
So as you know what, I was with a client on Friday for that same reason, and the solution, simple as it was that the scatter rug becomes a wall covering.
Right. Good
So,
idea. You get to keep it. You can look at it every day.
The idea is that we're not going into people's homes and making drastic changes that make them not want to live in their home.
Right.
The idea is that some really simple, preventable steps. So whether it's inadequate lighting, so the journey from the bedroom to the bathroom for most people is fraught with risks, right? So lighting, inadequate footwear, and a lack of handrails or grab bars. And
when you say inadequate footwear, are there do slippers contribute to falls, or do they help prevent them?
So we all probably have a soft, fluffy, pink pair of slippers.
Mine are pink. How did you know?
Mine are too. And at the end of the day, if there isn't a decent rubberized sole on those slippers, then that's one more thing that again we know that 90% of hip fractures are caused by falls. So if it's a pair of slippers, the difference between fracturing a hip and eventually ending up in a hospital, for us and our clients, certainly it's the type of thing that we can deal with that.
And it's also, for hip injuries, they can be very serious and lead to other complications. You may think, breaking a bone is not that big a deal. Of course, it's a huge deal when you're elderly.
Yeah, so the numbers, again, don't lie. The numbers are that, 20% of seniors who suffer a hip fracture will die within the first year.
Oh, my goodness.
Yeah.
And it could have been preventable.
If it's a scatter rug, if it's maybe it's mobility issues that, a little bit of leg strengthening exercises, sitting in a chair, can make a huge difference in stability.
So you recommend people do some strength training as well?
Yeah, so when we do our assessments, we, again, come up with all of these risk factors that are independent or individual for each client and their family, and we try to come up with easy solutions that hopefully can avoid this from becoming the reason people can't live in their homes.
So what is the best piece of advice you can offer to people who are perhaps getting a little bit older or have elderly relatives?
You know what? Right now, I think because of our Fall Prevention Week, it's to call us. Right? The idea for us is that the assessments are all free, and again, if it's the kind of thing that we can come in and pick out a handful of risk factors that will make a difference in keeping somebody at home, then that's a great way to start.
Great. Well, thank you so much for being here, Drew.
You're welcome.
And of course, if you would like to call and make an appointment, we have the number. It's Nurse Next Door Home Healthcare Services, 604-228-4357. If you would like more information, there's more information on their website. You can head there at www.nursenextdoor.com. Well, thanks again for being here. Really, really valuable information.
Thank you for having us.
Well, Christy has more of small